some tough questions. What about like pushback from physicians in your community, whether they be employed physicians or physicians who don't understand what you do? Do you guys get a lot of flack or criticism? I know it's a tough question to answer, and you don't have to mention anyone specific, but how do you guys handle that, or does it even happen?
The funny thing, well, first of all, most of the physicians I talked to before I actually transitioned did not think it was wise. My stepdad is a family doctor, and he told me it would fail miserably. And he's at the retirement age, and so he talks to me all the time about, will you hire me for a couple more years at this point, jokingly, because he'd never make it in DPC. He likes to be in and out. He doesn't like to spend time. But the interesting thing I thought in my neighborhood is I was literally a half a mile away from a physician who went to this conference when it was in San Antonio a couple of years ago, or whenever it was, and she converted to DPC and joined another DPC company, and I was confused by that at first, and I saw her at a meeting, and she was like, well, I didn't even know what DPC was. And I'm like, I am literally a half a mile from you, and I've been doing it for 2.5 years. And so my point is that I've come to the conclusion that a lot of the employed physicians are so isolated from physicians who are not employed by their hospital. They only see the other employed specialists. They only see the other employed family doctors. And so they're so isolated that they don't really even know what's going on outside of their system. I found that kind of fascinating. So that's something that we all have to correct. We've got to tell our colleagues about this.
I think one thing, and I have a heart for physicians who are struggling in traditional system. I had a HMO patient recently who had come to me. She got her mammogram through her HMO doctor, but the doctor didn't have time to do a clinical breast exam. And I did an exam, and she had a mass, and so we needed to do an ultrasound. And so I ordered that, and then she ended up needing a biopsy, and the primary care physician was just furious. She said, this is my patient. She has to decide if she's going to see you or me. I'm not doing this anymore. I don't feel okay with this, and she threw a big fit. And that was the first time I've really come up against someone so angry about it. And I think what I can do, the position I can come from, is understanding that it's difficult in that position, and seeing someone on the other side, there might be a little bit of jealousy or frustration about us being able to do this. So I think that's something to look out for, and have empathy and understanding for your colleagues who are still grinding away while you're floating by on your DPC happy place. So
I think this is a real thing, and I trained at the same institution that I worked at for 9 years, so I was part of this sort of tight-knit academic community while I was there. And then I left to do DPC, and it was, for a while, very frustrating for me because even in explaining to people what I was doing, I did get a lot of pushback and a lot of questioning and sort of almost like accusing, like, who are you to leave the system? Who are you to leave and leave all of us here? And what I came to realize was, yes, to just sort of have empathy. I think when you think about someone who's maybe done their whole career in the fee-for-service system or in academics, they've sort of devoted their life, and we, those of us who worked in that system know how much you sacrifice just to take decent care of your patients, how much of your personal time and your family time that you sacrifice. So I think there's a lot of defense mechanisms that come up when people hear this new idea, and it sort of challenges what they may have spent years or even decades of their life doing and supporting. But the fascinating thing is now I've been in practice 2.5 years, so I have physicians who are now interested in being my patient, and I have physicians kind of pulling me aside and saying, hey, what is this that you're doing? Like, how did you get started with this? And I'm really interested in this. And so I think it just takes time. And so I've learned, I'm naturally impatient, but I have learned to try to be more patient with that and more empathetic and patient with those who this is new to.
And the only thing I would add to that is, I teach also part-time at a local residency, so I'm somewhat involved in academics, and the academic community sometimes has a little bit stronger pushback for DPC. But that's not the case among residents. So 50% of the new residents at in the incoming class for interns at our residency expressed an interest in doing direct primary care in the future. So they really get this, and this is something that I think as we continue to train those upcoming classes of residents and doctors coming out, this is something that they see, and they see it as a way that they can practice the style of medicine that they're really looking for mentors for as well. So if you're doing this, pick up a resident, pick up a student, get them in your clinic with you, show them the way that this can be life-giving and exciting to practice medicine.